And I'd like to say good afternoon to everyone who is joining us now on StreamYard and also on Facebook Live. Welcome to Dr. Kip Speaks. Today we have an amazing program for you. It's dealing with something that is very current to us, but it's not new. But the intensity of this is what makes it so important that we deal with this. We are in a time of COVID, and during this time, COVID has not introduced us to grief, but it has intensified the grief that we are feeling, in, based on all the losses that we've been going through here lately. And so what I've done is I just reached out to a person that is amazing, and her name is Dr. Chris Williams Falcon. And I've known her now for several months. She's a wonderful therapist. She's a wonderful person and wonderful intellectual person that is just full of wisdom, knowledge, and understanding. Let me just give you a little bit of a background. Don't be laughing now, Chris. You said this to me. You know I'm telling the truth.
I'm gonna go with the flow.
Chris is just trying to be, just coy about this. But I'm not gonna let her do that. Listen, you know how they say, listen, you get all these people, you say all these great things. Well, maybe other people are into platitudes, but I'm really not into platitudes.
No, sir, you're not.
I'm just giving her due. Listen, anyway, let me just say, listen, Dr. Chris Falcon, she's a PhD, an MBA, an MSW. Now, that don't get better than that. Got a PhD and 2 master's degree. She completed her master's degree in business and a master's degree in social work. She went on to complete her doctorate in psychology from the strong focus, with a strong focus on military family. And by the way, she's going to be talking about that because she has some really good information about that with all the military losses that we've had recently. Military grief, women care, and traumas. Yes, she's right on time today. She is a triple negative stage 2 breast cancer survivor, and you need to listen to her story. And the founder of Life After Breast Cancer. In other words, she's saying there is no hopelessness in this. There is life after breast cancer, and she's a living testament to the fact that there is good life after breast cancer foundation that offers free mental health care. Oh, free? Oh, Dr. Chris. Yeah, free. Did you write that right? Did I get that right?
You got it right. Free mental health care to breast cancer patients.
Oh, man. And their families.
And their families, yes.
She has over 13 years of clinical experience across the variety of settings. She's a kind of a, eclectic kind of a person, including outpatient, specialty clinics, crisis intervention, structured outpatient programs, addiction, large nonprofit, and private practice. Dr. Chris is a public speaker regarding medical and mental health care within communities. She has provided clinical and administrative supervision to social work students, interns, and professionals. She has a broad range of clinical experience, now that I know, working with individuals and groups across the span of various areas. Dr. Chris, welcome.
Thank you for having me.
Oh, listen, it is my pleasure. And I know that you and I, in preparing for this, we talked a lot. And, we've got some time now until about 2 o'clock. And I know that this subject matter, it is not exhaustive by any means. But I know we're going to run out of time before we even crack the shell to get to see the egg on the inside. I know that for absolute sure. So one of the things that I'd like, you to start out with, and I'll just jump in now and then if I have anything to say, that is, because you're the expert on this. But can you just tell us in a very broad, general kind of a way, what is grief? Because a lot of people seem to think that grief is directly related to death and death alone. Now, and while it is, but that's a very narrow scope of belief and focus about grief. It's a very broader scope, and you bring that to us from a military point of view and a personal point of view too. So even as we were talking about your cancer, there is a loss inside of this. So why don't you just go ahead and just kind of just fill in the blanks for us. Connect the dots, okay?
Yes, sir. I define grief as a detrimental and a emotional loss that creates a trauma or a harm to your mental psyche. And, although, it also has the potential to incapacitate a person physically and mentally. Now, that person has to face this difficult and important understanding that there is going to be a need to mourn. And for me, mourning is a very open expression of a person's thoughts and their feelings regarding this loss that has impacted them so traumatically. And again, this can be mentally affecting a person or even physically affecting a person. And many of us are going to face some level of grief. And you're right, there are many faces to grief. When individually, we as people, we naturally think that grief has to always, take the shape of death. And that's not necessarily the case. Grief can happen when you are diagnosed with something medically. You can face retirement. It can happen in divorce. It can happen when, we have children who may move away from their friends. If parents relocate to different areas and they move away from the school, that child is going to mourn the loss of even that relationship, or even parents are going to mourn this absence, this loss of their children, even moving away out of the home, either by, becoming an adult and being, college. And, I'm a foster mom. So I actually see the grief that, parents go through when they have lost custody of their children, even if it's but for their actions. Just the fact to have someone come in and sever that relationship and remove their children from the home, those parents absolutely go through a mourning and a grieving period from the loss of that child. And let's be clear, grieving, mourning is very essential, in my opinion, to the healing process. And there's no definition of a certain order that grief can happen.
Okay, listen, let me just say something. Okay? I want to back up and say, look, one theorist says that there are degrees of grief, and there are different kind of impact that grief has on a person. And what the theorist says is that the degree of attachment that you have to, this is what they call object, relations theory, to the object, which in this case is a person. The degree of, like, if your attachment is out here, okay, and the dependency is out here, it's not like it's here, right? And if it's like here, it's not like it's here. And so when people degree of dependency and attachment here, when one of those persons that they are attached to is no longer physically and or emotionally available, there is this huge piece of them that is lost and unavailable, that is still attached to the person that is unavailable. Now, do you understand that to be true, and if so, how does that work with different people? Because people just act out grief in a different way.
Absolutely. We're born attached. From the moment we as human beings are born into this world, it's naturally instinctive for us to have an instinct to attach to someone, whether it's the mother and how we feed, as children, to sense, to sounds. And honestly, this could even begin in the womb. So in the understanding of that, in the womb.
Can you hit that a second for me, please? Because
exactly.
What is it?
Exactly. People, I have a colleague who recently, I gave her this plant, this plant that I just knew someday it was going to die really soon. So I had just given up hope on even trying to keep this plant alive. So I gave her this plant and she's telling me, she's like, no, you have to talk to the plant. They recognize your sound and your voice and whatnot. And And I remember thinking even then, I said, that happens to us as children, as our parents are talking to us in the womb, as our parents are attaching to us before they even see us, and our children are attaching to our voice, our sound. When they're born, the nutritionist will even come in the room, or the nurse, and say, our children are adapting to even our scent as to who we are. We can see it in instantly. I remember my niece being such a very young child, maybe 3-4 months old, and each person trying to hold her. And I mean, the more we passed her along, the louder she got, until she even made it back to my sister's hands, and then instantly she stopped crying. She may have whimpered a little bit, but she instantly started crying because she recognized again, oh, this is who I'm supposed to be attached to. This is my mother. This is her sound. This is her scent. These are her hands. This is how she feels. So we are instinctively attached, from the womb to when we're born. And our first relationships, again, is going to be our families, our parents. So we are tied, develop a codependency to these individuals. And if it's truly a healthy codependency, we will learn to understand, to love, to care, to even express our feelings. So in that concept, we as human beings have to have this relationship to secure attachment as a basic instinctive matter of just being who we are. And for me as a therapist, in having this attachment and even explaining it to people who are going through grief and how they process empathy, this helps us as clinicians to guide them and to assist the patient to truly navigate through all these, conceptualizations and approach the pain that comes with the grief and essentially the loss.
Right. Listen, as you're talking about children developing attachment to parents in the womb, and it's mutual because the mother is also developing attachment, especially when it get to the point where the fetus is beginning to move. Yeah. And mother's face beam because they need the baby, they need this thing to move so they can know that this child is okay, and then they're okay.
Yes.
Because at a certain point, if fetus is not moving, they begin to get concerned. Now, if they get so concerned, that they get stressed out. That stress passes down, crosses the umbilical cord, and hits the baby. So we know that. Let me tell you this. Let me tell you. I had a client one time, and it really speaks to the point that you're making about grief. This man, they had a dog. It was his dog. Okay. It was his dog. Okay. And this dog knew the time when he was coming home every evening. I mean, when he'd be at the door, just standing there, just looking out like that, tail wagging, looking out every day. And then the dog knew. And when the truck came around and entered into the garage, he'd bolt around to the garage, right? Well, one evening he was there and the truck didn't come around the corner. And he started whimpering and going back and forth, and they were able to put him in his cage, and kind of just stayed there all night, didn't happen. And the next day, and the next day, and the next day, kept on going to the door. Finally, when he didn't come home, of course, they can't say to this dog, that your master is dead. The man died. In about 2 or 3 weeks later, guess what happened? The dog died.
Oh my goodness.
Broken heart. Dog died of a broken heart. Separation from an object of this man, which was always available to him, and the degree to which he was attached to this man, and the way that they would walk through their routine. He would come in, he'd jump up, he'd pat the dog, and the dog would be running around the house, and the dog missed that. The dog missed it.
Yeah, I remember it's been a while, and I remember reading something on, I think it was like the American Heart Association, and that has been that's real, and it's called stress-induced cardiomyopathy, if I'm not mistaken. Cardiologists listening, I'm sorry I destroyed that word, but this is real, and it can strike even if the person is of sound mind and
Right.
of a healthy being, and it is an emotional pain that is, that actually, and this has been diagnosed, it's been studied in Switzerland and in Canada, that when a person's heart is broken, it will temporarily even enlarge the heart due to the stress, the emotional stress that's on the mind and the body, that the walls don't even pump as they should.
Oh my.
So in a sense, this emotional stress, this divorce, or this physical separation, whatever has caused this emotional stress, it creates these abnormal contractions that they now actually have a sense of calling this, the actual broken heart syndrome.
Right.
And people do die from this loss. I have seen, I think our second case for me, working in addiction hardcore in Georgia, I've had mothers come in who has had their baby, has carried this child, but they began treatment while they were pregnant, and then their child is taken away from them at birth. And we know that they're in the hospital, but we don't hear from them for a while, but they immediately have all kinds of medical problems that stem from having their child removed from them at birth. The attachment has already happened, as I said earlier, but the emotional hurt, when they say my heart hurts, that's real. My chest hurt. I can't think. I don't know what to do. You shut down. So, a broken heart absolutely contributed from a loss, which is again grief.
Right. And that is so true, because I ran into an article one time where it said that this broken heart syndrome, and I'm glad they're calling it that, the broken heart syndrome, because it's very real. It's a real experience for a lot of people. But in this broken heart syndrome, we discover that the mother, as well as the child, can go through this. And in going through this, it begins to create all kinds of thoughts in their heads. Now, when the mother, and the circumstances under which the child is no longer available, especially if the mother was saying, listen, let me paint a kind of a picture. If because of the way I was raised, because my experience as a child, I was never validated, go through all of that, people didn't like me, my picture of myself is not really good. So I have this baby. And I'm going to have this baby because now this baby will allow me to feel everything I've always wanted to feel that I've never felt. And now I have this baby. Now you got to understand, now, this is not just a baby. The baby is now an extension of the self. The baby is now a part of the person that lives outside of the person, right?
Yes. Absolutely.
And so when that baby, and you flip it around, when the mother is not available, when the dog's owner was not available, it changes your thoughts. It changes your emotions. It goes, change your thoughts right here, your emotions over here, and then your behavior. So you go down through it like that. So when you do that, and so these mothers that go through this, now, are there ways that people kind of deal or try to deal with that? That are not necessarily good. Some people, But okay, let me speak specific to this and then something else. Is there a direct correlation or an indirect correlation or a circular correlation between, say, suicidal ideation and the active attempted suicide with the loss that is related to grief? Because you nailed it. You said, listen, So, grief is related to loss of all kinds that, and it's dependent on the degree of the attachment and the dependency that you had on this person or thing that is no longer. So is suicide? Is there any relationship to grief and loss?
Absolutely. Absolutely. Even if it doesn't, if that person doesn't follow through with it, they're for me in working with grief, I've seen three different levels when it comes to suicide.
Go
So
ahead.
the first
Go ahead and
Yeah,
talk.
so the first one is kind of the empty threat, that emotionally that's where your mind goes, even though you don't have the will to even attempt. But you may say, I want to die, I can't take this, I don't even see a purpose to my life. And of course that puts people on alert because they assume,
Right,
okay, this person is talking abnormal or
right,
bizarre.
right,
And we need to really watch this person,
right,
but their hurt makes them feel hopeless, or there's no reason to even persevere or move on. So they, in a way, just fail to continue to thrive on the capacitated level that people are used to seeing them work on. So I call that the empty threat of a suicide, but it still raises awareness that this person needs to talk to someone.
right,
So
right.
then I see the NSSI, which is the cry for help, that yeah, they do want to die and they may challenge themselves to cut into themselves just to see how far they can go. We hear about NSSI when someone is physically or sexually traumatized as a child or an adult, but also when it comes to suicide ideation, I see that they are actually contemplating, and it is sometimes seen as a part of the plan that they are actually going to act on it sooner or maybe later. But when I see those signs, especially if I see someone cutting into or I see the scars, like, ooh, we got to explore that. We got to talk about that, because that for me creates a spider web of concern. So I've seen it that way. And then I've actually, have this, what I call my third level, where they have actually tried it. They've taken pills, or they have, consumed alcohol and the pills. They have actually drove and hit the speed and stopped right at the lake or right before they hit the tree, and something pulls them back. And and sadly last week, I was even notified of someone who has been grieving for a long time, that he actually, he's no longer my patient. I haven't seen him in 5 years, but he actually got to the point, because he had another loss due to COVID, of someone who was his best friend for 18 years. He was on dialysis and sadly, contracted COVID from somewhere, and this gentleman died. So he had already lost his grandfather, who was pretty much his father growing up, and now his best friend, his brother, who their birthday, they were literally 2 days apart in age, that he grew up with, had died. And he actually went all the way to drive into a barn or something in Guyton, Georgia. And he survived, but he's in the hospital now. But of course, we understand that he's going to be transcended for additional mental health care. So I hear these different levels of with people who are going through grief, and how they enact on it when it comes to suicide. As you can see now, it can definitely vary, but it still raises awareness that that person needs to talk to someone, because they're not maintaining and they are mentally crumbling.
Right. Suicide is it's really such an in-depth whole body experience before you get there. We just, I'm glad you touched on it, but I think it's something that we really need to look into and ferret out a lot of the, the idiosyncrasies, the nuances
Yes.
about this. But I want to say this. I was listening to a psychiatrist, and he was a psychotherapist too. He said that if somebody makes a definite attempt, they ain't playing around, they want to die. This is it. I want to die. I don't want to see another moment. And he said, and then if the person if they wakes up, right? How do you think they'd feel? He said he asked a client that one time, when the client said disappointed. disappointed that I was not able to do the one thing that I thought I could do, and I killed myself. That he says, listen, be careful, because that person is a risk to try it again. Right. So I just want to throw that in. But Dr. Chris, I want you to, a couple of things I hope we can kind of get to in terms of grief related. But I want to start out with the one that you've been talking about for a long time, and that is different things in different levels and different impacts, and the systemic impact of grief in the military.
Oh my goodness, yes, it is.
I know. I'm not asking you for top secret stuff. I'm just talking about just general stuff.
Oh my goodness. So, when it comes to grief and the military, that is to me, especially working closely with military families, right. I see it from all parts where, children have to adapt to losing a parent, a spouse has to adapt to losing a spouse, the soldier has to adapt to losing a brethren. And it's not just in the physical form, because we grieve again differently, and we grieve depending on the scenario. So we may have survivor's remorse grief, we may have that we
don't listen when you drop these things on us, okay, don't just say we have survivor's remorse grief and pretend like you think I know it's about. I want you to tell me what does that.
I'm gonna break it down. I'm absolutely gonna break it down.
Okay,
so,
break it down right now.
So survivor's remorse.
Yeah.
There are two. I see it in two different ways. I see the survivor's remorse that they are still alive, but the fellow soldier is not.
Is there some guilt in there somewhere? Guilt? Could there be some
guilt? Is absolutely there. Guilt is absolutely there. Especially if they're walking side to side with their friend. Fire opens out wherever they are, or IED, which is a form of a bomb that's used against troops in certain areas like Iran, Afghanistan, Somalia. They're walking side by side with their friend, and all of a sudden their friend is shot. Or there's this bomb that's taken out, not just one friend, but numerous friends, and you're still standing watching this unfold, and you can only help one person at a time. And then there's the survivor's remorse that I see that, someone comes back 100% intact, but their friend or fellow soldier did not. And this fellow soldier has lost an arm, or their vision, or they can't hear, or they've lost, a leg. So, they have to help that person grieve that.
Okay, you're going to go on with that in a minute. But let me just kind of intensify a little bit. What if, a soldier was assigned to a duty, and somehow, I don't know how this military works, but somehow, I talked him into man, you go, and he said to me, man, you just stay here and chill, man. I know. I'll do this for you. They go out and he dies, or he's decapitated. What do you think happens to the person who should have gone but stayed behind, maybe for something that was not death-defying or anything like that, and now they have to deal with this tremendous guilt and grief of this person? Oh.
So first of all, we need to throw the B word out there, and that's blame.
Okay.
They blame themselves that, it should have been me, or had I gone out there, would I have made a different decision that they did? Would I have patrolled or gone on this envoy in this area? It's a lot of blame. It's a lot of guilt. It's a lot of emotional bullying that I have seen, individuals doing. And then, of course, that leads to possible self-destructive behaviors, where now it's starting to affect that person's career. Yeah. So,
and even suicide. If the grief and the guilt is so great, they may say, man, I should have gone, and then he didn't. Now this person,
Yeah. And where's the comfort on these men and women who find themselves in this position? It kind of falls on deaf ears. They're not trying to hear it at first. They're not, because again, we all cope differently. You know, Dr. Elizabeth Ross says this, and Dr. Warden says we cope differently, and they have their own perception on how we cope. And there's no certain order, and it doesn't matter if you are a man and you're supposed to have this ego and this strength that you're supposed to, you know, be able to take it. You know, we're all only as strong as glass, and something is out there that's possible to break us. So, you know, when I'm dealing with these soldiers and I'm hearing it, and not just, you know, soldiers that are young and functioning and are really retiring now. I see this with Vietnam veterans. I have a client that I used to work with that actually carried pictures of soldiers that, you know, in legal war. We're in Vietnam. He's 18. He's drafted. He's a Marine. So they send him to the front line. You know, and it was ironic. He said, I tried to fail that test so that they would say, this guy is dumb. Let's put him on something else. But he aced the ASVAB. So because he aced it, they put him in weaponry, and they trained him well, and they put him at front line. So he had to take life in defense. So, but as a punishment, for almost 60 years.
Okay.
He has kept pictures of soldiers that had protected him and died. He's kept pictures of Vietnamese soldiers that they've had to take the life of. So because of survivor's remorse and blame and guilt, and he's back in this free world, and those guys are no longer here. Plus, there's even the guilt that soldiers have even when they're defending themselves and they've taken someone's life, because they recognize that they still killed someone who possibly has loved ones, you know. So this goes in so many different areas, and he's just a prime example of, you know, how not only do we have all these different emotionals, but we still self-sabotage ourselves, or we fail to thrive, or we still punish ourselves because we are grieving the loss. We're still angry, and there's no expiration on grief. Let's be clear of that. There is no expiration.
No expiration.
So he still punishes himself, probably still to this day.
Listen, let me tell you. I was on another Zoom yesterday, and one of the participants said, you know, I live in a military town. That's what she said. I live in a military town, and lots of military. And one of the, and I got to ask you this, because, you know, I got to ask you this. Is it possible that because they live in a military town, because people are in the military, on boat, base, on post, it doesn't matter where, that this whole idea of loss that creates grief, is it possible that some of those people could go either way? They could become very clingy, or they could, you know, distance themselves from people, because by distancing themselves from people, and I don't mean physical distance, but emotional distancing themselves from people, it would mean that the fewer people they have, they might their relationship with people might be like out here. They're not going to do this. The last time they had a relationship like this in the military, like you said, somebody got shot and killed. Now, is it possible that they may be dealing with even what we call anticipatory grief, which means that I don't want to have to grieve like that. So what I will do is I won't develop close relationship, so that when they're not here, because I anticipate they won't be here, I don't have to go through this loneliness, this chest wrenching. I can't breathe. I hyperventilate. I don't want to eat. I can't sleep. I just walking around in this day. Could they say to themselves, "Hey, listen, I don't want to have to be that close to people because I don't want to have to grieve." Is that possible though?
Oh, absolutely. You know, let's call it what it is. It's borderline. It's like a mixture of an antisocial disorder.
Okay.
Then there are phobias, thanatophobia, the fear of death, or the fear of death unto your loved one, or we have some agoraphobia. So to narrow it down, just to understand how, you know, they kind of tie in together. You know, what she's talking about is isolation by choice. It's when we reject, relationships. We may even reject society. We may even, go off the grid. A lot of people move off the grid. And there's actually a show about people who plan to move off the grid away from people. And most of these people, ironically, are former military. Either they got out by mental health, by medical reasons, or they retired, or they just did one contract and one contract was enough and I'm out. But to even go into depth of what you're asking, yes, this is isolation. These are different. They're different, various disorders that you and I probably could call out that comes after someone, and it's not just, with the military. That's with anyone who has witnessed a traumatic, loss or event, or basically, our conversation today is about grief. So we're going to stay with that. But to keep away from or to stop oneself from doing something, that is avoidance. That's the clear understanding of what avoidance is. And if we're going to dig into it, it doesn't seem to be complicated because, we can avoid, friends, families, and whatnot. But, to avoid something intentionally, consistently, every day for months to years, that raises concern. And when we talk about avoidance, when it comes to grief, we're usually referring to what is called experimental or experiential avoidance.
Right. Okay. And so when they do that, even if I could see this really going, in another direction where the spouse who is actively deployed and the spouse who's at home can, in anticipation of losing that spouse, they may begin to, distance themselves emotionally, separate themselves emotionally, because they're waiting for the bomb to drop. They're waiting for that knock on the door. They're waiting to see that military car pull up outside and that bad news. And they don't stick around and give you therapy when they do that. They just, it's kind of just hit and run. So now, but in doing that, in trying to avoid this avoidance you're talking about, they're also missing out on a quality of life that's available to them because they are not sure whether or not that loved one will be lost or come back home. And that, if they have children, it takes it to another level of
it does. It does. And we understand that this is a shift in that person's reality, their norm. So, with their husband or wife going off during the deployment, even if it's not necessarily a deployment, to foreign territories, sometimes, our soldiers train within the States and they're sent away for 3 months, 6 months, until they complete that training. But, and what I like to call it, when I see it in certain individuals, this is a pre-prepared grief. And they're trying to kind of get a contingency plan in order, as this is how they're going to cope with this loss once this person is gone. And sadly, I've seen it both ways, Dr. Kitts. And I've seen it where people are rejoicing, like, oh, you're going to deploy? Or you're going into training? Okay, bye. But what I can take from that is that, that attachment has been severed already. That, that love or that atonement that they should have, that's already damaged. So whether they're here or not, it's not going to matter. And sadly, I've even seen an attachment happen with the children where they don't even attach to the mother or father who is in the military because they're constantly gone. So they recognize it's no reason to even try to bond a relationship. Then the people retire and they grieve right there in the home because they're trying to have a relationship with their wife or husband or children. And they're not necessarily allowing that bond to happen. So then they start to feel that grief from the loss, that they've lost all this time with their family.
All this time, not only that, they've lost all this time, but now, not only have they lost all this time, but now they're coming back.
Yeah.
And there's a whole another set of dynamics. When I'm coming back, I need to pick up where I left off, that kind of stuff, and that creates a whole lot of disruption, which could lead to separation, divorce, and all this kind of stuff. But we have
Absolutely.
all of those losses that people, have to kind of deal with. Now, I know you got a book this fact with all kind of facts in your head about the military stuff, but and we'll hit that another time. We really will, oh,
But I want to go back to something about, when it comes to avoidance,
okay, go ahead, go
I
ahead.
think some people don't realize that this is truly an internal experience, and it can absolutely feel, mentally and physically painful. And I think when, there are times, and you and I kind of hit on this, where people will try to stop other people from grieving because they don't know how to cope with it and they don't know how to help that person. All they can do is witness the pain, the emotional breakdown that this person who's hurting is experiencing, and the person tries to stop that individual who's mourning from mourning, so they don't lose even that relationship that they have with this person who is grieving.
Right.
So and some perceive it as being even selfish, that they want to help this person avoid grieving. And that goes back to even what I said earlier, that we have to mourn, we have to grieve, and we all do in some way. And I guess it's a conversation for another time to understand how we do self-destruct,
Right.
even from having a loss, and how some people are selfish to try to stop, and I call it selfish because that's just what it is. When we try to stop that person because we don't know how to deal with it,
Exactly.
and we don't know what to say
Right.
to that.
Right. And let me just kind of push it a little further in my understanding. I would try to stop you from grieving, because the way I deal with my grief is I put it somewhere. I put it in a closet somewhere, lock the door, and pretend that it never happened. Now, when I see you grieving, what it does is it calls back into my consciousness that thing that I put in the closet. So what I want to do is I either avoid you because you keep on reminding me to remind myself about that thing I don't grieve about, or I say to you, oh, but Dr. Chris, it's been 5 years. Are you going to be doing this like this for a long time? Oh, girl, you just need to go on and get you a life and just move on. You're just stuck. You're a beautiful young woman. They tell you all those things. Why? Because you mirror this, and that thing creates the pain, that avoidance again, that they're trying to avoid. So I'm so glad that you said this very powerful thing. There is no, what you call it now?
Expiration.
No expiration date on
Grief. There is not, and if I'm going to even personally speak,
I love that.
My grandmother, my great grandmother, she passed away in 2004. She was 104 years old. But she was one of those, first of all, to be able to be blessed to have a great grandmother was amazing. To see her live, a life of such longevity was amazing. But, she was always someone that it was really easy to talk to. And to lose that, no, she's not going to live forever. The Lord is not going to forget that she's here. 104 is a long time. But still, to this day, there are certain things that I will even get emotional of. Again, we're 2004. It's 2021, and we still grieve and carry that hurt. Even though we can laugh at some of the crazy things that she may have said, how she would joke and whatnot with her great grandchildren and even her children, there's still a hurt there that we no longer have access to that type of love or the relationship, or even that history that she brought with us when she would tell us about things. We can reminisce about it and smile about it, but there's still a bittersweet sadness that follows it, and you learn in time to make the best of it. But I've seen, also, when it comes to grief, that, in an attempt for people to avoid even those who are sick, they'll avoid going to see that person because they're
Yeah.
already grieving. They're
Yeah.
already grieving. And it hurts. And, I see it in working in hospice, when we have to talk about DNRs and things like that. And, some people are like, I don't want to hear it. And I've even asked, is there insurance on this person? No, we don't talk about things like that.
Right.
But that is inevitable.
Yeah. That is so true. But sometimes, like when you talk about your grandmother, kind of reminded me of this. That the degree of attachment. Like, I'll go back because I want people to understand the function of the degree of attachment, because you can be so attached. I'm just hearing you talk about your great grandmother, that this was not just your grandmother.
Exactly.
This was a part of you that was living outside of you. So when your grandmother was no longer available, that part of you that was living outside of you, that was embodied in her, is no longer available to you. So in other words, there is a piece of you that is no longer available to you because that piece is now residing with your grandma. The way that works is she's no longer available to do for you or do to you the things that you enjoyed. Her cake, her this, that, nobody's cake.
Yes.
All those things.
Yes.
I'm sorry, Betty Crocker cannot replace those things. Okay?
Exactly. Nobody can. Nobody can.
You hear people talk about grandma's greens and grandma's corn.
Yes. Every Thanksgiving, I tell my husband, I'm going to try to make these collards. Now, they're not going to come close to my grandma. Like, I have to measure things out. I never saw a measuring cup or a spoon in her kitchen and whatnot. So, and I never come, I come that they're good, but they are not the mouth-watering, anticipating, taste that you get. It's a different sensation that you get.
Yeah, and that is the truth about you cannot replicate, just like you can't replicate. You cannot replicate the quality of a relationship by getting somebody else in your life when you break up with somebody. When you break up with a person, when a relationship no longer exists, the way to do this, then we're going to go on to COVID. The way to do this is you must grieve every loss. I don't care what it is. Grieve every loss before you attempt to attach something or somebody else in the place of that person that is no longer. Otherwise, what you do is you have an overlay. The new person you put in there, you're always looking to them to replicate the person that was no longer here. Why? Because you didn't deal. Because that part of you is still looking for and longing for that person to be here, but they are not, and so it makes it difficult for you to emotionally bond with this person like you really know they should. Listen, Dr. Chris, we got about 9 minutes, and that's about all. Ooh. But listen, can you talk about COVID? This is very current.
COVID is
closing moments out talking about COVID related grief, mass graves, and all of those things.
So we hear, and I don't know if some of the listeners watch the news, but the news make it a point to remind us every morning that COVID is real. It's still out there. Right. Now wear 2 masks, have your hand sanitizer. Right. And if
climbing every day.
They do. They climb. And again, that's just what of the people who go for medical care that they're reporting. It's not even the ones who are afraid to seek medical care. Right. I had one person actually told me, I want to say probably April last year, and if I caught COVID, I would never go to the hospital because they're going to put me on a ventilator and I'm going to die. So this has made people develop all kinds of phobias, and for those who have lost loved ones, again, thanatophobia is so real that they are overprotective and they don't want their children to leave the house. When COVID came out, people were dropping rapid. There was no time to prepare. there's never really, time to prepare for a loss. You think you have yourself in order until the loss happens and you realize you did not have it all together. But COVID, especially in the African American communities, is severe. And it's taken out, in a high abundant rate, just people, period. But COVID, in the few cases that I have seen where someone has lost, like the gentleman that I mentioned earlier who lost his best friend to COVID, this is sudden. This is unprepared. This is a disease that is really new on the scene. We did not grow up understanding COVID was there. This is new. We were thinking that there's an instant fix to this. It has taken over almost a year to create a vaccine. And then there's, people are second guessing even getting the vaccinations, because now they're saying, oh, there's an African COVID. So just when we think we're getting out of the woods with COVID-19, now there's a new, virus called the African COVID that is, spreading. So, people are afraid. People are already grieving, fearing grief. Right. People are developing phobias. People are becoming overprotected. People are not allowing their children to go to school, or people don't want to go to work. Right. COVID is affecting not only those who are dealing with the sudden loss to this disease, but it's also, creating an imminent fear in people who are, trying to prevent their loved ones from dying so that they don't have to grieve or cope with the loss. Right. So, I know our time is limited and so far that we can go, but I mean, it's really taking the world by storm, especially what you said about the mass graves.
Right. But listen, let me tell you this, man, we just got to come back and do this more. But listen, I was listening to a person who lost 3 members of their family in 1 week. In 1 week. Okay. Now, I don't know. If they call me, I'd just be sitting there looking and shake my head. I don't know.
You don't know what to say. You don't know what to say because, again, that is beyond trauma. That is detrimental to a person's psyche. Okay, and then you get this what next effect. What can you say? And going back to something you said earlier, they come to us to help them stop grieving, but in situations like that.
Situation. Let me tell you this. Since you said that, just that. A part of the reason why I may have difficulty working a person through their grief is because their grief is reminding me of my unresolved grief. And as a clinician, I want to get rid of them as quickly as possible because I'm still having difficulty with my loss, my grief, and you, the client, comes to me. And sometimes, we may even preempt them up front and say, no, I don't deal with those kind of things. Well, I do, but I don't want to deal with yours because I'm still dealing with mine,
Exactly.
And then you have all these first responders who have had losses, who have had buried people, their own family, and they still have to go to the hospitals, the fire trucks, the EMT, all of these people, they still got to go out there every day. They can't say, listen, man, I'm in grief. I can't. No, they got to go.
Yeah, that's our counter-transference that's happening here. I've seen this, because I used to actually go out there and do crisis intervention with EMS workers and fire department when they are on the scene for something that is definitely traumatizing, right. And try to do crisis debriefing with them. And it's in that moment when it's right there in your face. The only thing you can do is pull them aside, do a check. How are you feeling? Do you feel like you can go on through the night? Do you think you need to go home and we meet tomorrow? I do a quick, depression assessment, anxiety assessment, and whatnot on the scene. Everything's verbal and it's happening so fast. And the reason I pulled away from it is because that is not enough time to deal with someone who has just witnessed a crisis. Plus, if they have gotten there on the scene, and this has only happened once with me, they've gotten there on the scene, the person is right there alive and talking, but time was against them and the person dies on the scene. they got to carry away that, gosh, if the car could have got here faster, if this could have happened, if that could have happened, whatnot. And like you said, sometimes as clinicians, we do want to remove ourselves from certain situations, especially if we're still grieving over someone, and someone is bringing us grief. We're still, and I think this goes over people's head, that we are still human beings. This is our job. This is our career, but we still have real life situations that's happening. So, when we experience countertransference with our clients, or even our clients experience it with us, because I'm that person that'll say, hey, I know all too well what you're feeling. I know all too well.
Your client needs to hear that. You need to be transparent. You need to be up.
Yes.
Say,
even though school tells us not to, we still are supposed to.
listen, the books got me through school, but listen, it's my clients who allowed me to do what I do, to whatever effectiveness I can do. So we have to know, because they don't want to know they're coming to a person who's at like wood, like rock. They want to know they have a person who bleeds and who don't mind sharing and caring, and can absorb some of the stuff that they're going through. That's what they really, really need. Well, listen, Dr. Chris, I'm gonna have to talk with you offline here, and I'll get in touch with you. But it is 2:00.
Yeah. This is a much needed topic, and honestly, we may have tapped into 10%. If that 10%.
We have not talked about grief and substance abuse.
Yes.
We have talked about grief and family systems.
Yes.
We have not talked about grief and morbidity and mortality of the self. We haven't talked about a whole lot of stuff.
Yes, even parent rejections of their other children when they have lost one child. How they cope, how they fail to cope. And then children take on the blame that, would you have been happier if it was me who died? So it's such a universal topic that affects everyone.
Okay. Well, listen, Dr. Chris, it's at 2:00. I'm going to talk with you off camera when we're done. Listen, I appreciate you.
Thanks for having me.
I don't have enough money to pay you, so I'm not going to pay you. You know how that goes. Listen. Don't insult somebody if you can't pay them what they're worth. Don't insult. So I'm not gonna be up.
Oh my God, it's my pleasure. This is getting the message out there for people who are grieving to get help. That is always an option. Get help.
All right. And I want to thank all those of you that are out there listening. I saw some comments that pop up, some really good. They said some good things. Nothing good about me. I'm the host, and they were all focusing on the things you were saying. Listen. Listen. I really want to thank you, and thank those of you that are on. And I know this week. We were running a little bit late and trying to get this thing on the air, but we're slated for every first Sunday at 1 p.m. So whatever the first Sunday is, I think it's next week, I will be back here. I hope I can get Dr. Chris. If I can't get Dr. Chris, I'll get a good substitute, but Dr. Chris will be back at some point, okay? So
yes, sir.
Thank you all for watching. Chris, thank you so much, okay?
You're so welcome. You're so welcome. Be blessed. Thank you.
All right.
Bye.
All right.